Thank you so much, Oreta, and thank you so much for the introduction. Again, my name is Yehemy. For those that are new, my name is Yehemy Zavala Orozco. I work at the Community Health Workers section as part of the leadership team, and also I am part of Comunidades Unidas. Today is a very special day because we're going to have this community partnership conversation. I hope that all my panelists are there. I cannot see you all, but hopefully you are there. And I just want to thank you for participating today and for being here today. And I wanted to ask you if it's possible to start with sharing a brief introduction of your name, the organization, and the COVID project services that you are providing right now within the state. And let's start with let's start with Nubia.
Excellent. Thank you so very much, Yehemy. I am here on the call and I'm so excited to be a part of the panel. Thank you for the invitation. A bold and beautiful good morning to each and every one of the community health workers on the call. Thank you for your service and your leadership. So my name is Novia Pena and I'm the director for the Utah Division of Multicultural Affairs. I was appointed to this position a little over a year ago. It was July of 2019. And this past year has been a beautiful, painful learning experience, and I couldn't have asked for better partners to do this growth journey with than for you. So just as a brief overview in terms of what we've done in terms of our partnership with community health workers, our division was appointed to oversee the Multicultural Advisory Committee of Utah's COVID-19 response. And in that, we were able to identify 26 racially and ethnically diverse community partners that were top up, bottom down, making sure that it was community-based organizations, state agency partners, faith-based organizations, as well as community leaders that could come together in conversations to discuss what were the needs around the pandemic and how they were uniquely affecting communities of color and those from systematically marginalized communities. So with that, we've been able to work closely with Yehemy, Orita, Janetta, Susie, several of the folks that are on the call today, Jake, and it has been an incredible learning experience. And so again, I'm humbled that I would be invited to join the panel, and I look forward to the hour with you all. Thank you, Yehemy.
Thank you, Nubia. Our next panelist is Theresa Garrett.
Good morning, everyone. I'm Theresa Garrett. I am an assistant professor at the University of Utah. And really what I am is a public health nurse and an average white lady from Sugar House who thinks that community health workers are the bee's knees, the bomb, and the most amazing thing that ever happened to healthcare. And hello to the many, many familiar faces on the screen today. It's lovely to see you. I'm here representing the Utah Public Health Association. I have long had a vision that the Utah Public Health Association, and my vision is shared and bolstered by many people, including Oretta, who I see from the chat that is well loved, Yehemy and many others who believe that community health workers deserve infrastructure, support, and representation, and need a place to come together. And I'm proud to have helped the Utah Public Health Association get to that point along the way.
Thank you so much, Teresa. Our next,
I love how you said my name, by the way.
Teresa. Our next presenter in the panel is Jennifer Puder.
Hi,
Jennifer.
Can you hear me?
Yes, we can hear you, okay. Jennifer.
Okay, thank you. Thank you for inviting me to be part of this panel. I'm honored, just like the other panelists. And happy to be here with you guys. My name is Jennifer. I'm a nurse with the Salt Lake County Health Department. I've been a nurse for about 24 years. I'm showing my age to everybody. And I've been with the health department for about 13 years off and on, as well as doing some other nursing jobs throughout my profession. Currently, I'm supervising our team of 14 community health workers that are part of the CCP project with the state. And my life before COVID, I was part of the CHW coalition that was mentioned earlier. So it's been wonderful getting to know all the community health workers over the years, and I'm appreciative to be part of it. I think community health workers are wonderful, and like Teresa said, they are the bee's knees, and I'm just happy to be part of the group. So thank you.
Thank you, Jennifer. And I see that everybody is shouting out on you. So it must be, you must be an amazing supervisor. Thank you so much for being here.
Thank you. Thank you.
Our next panelist is Dulce Diaz.
Good morning, everybody. I can feel all the positive vibe, among the people. My name is Dulce Diaz. I'm the director of the Office of Health Disparities at the Utah Department of Health. Early in the pandemic, I was in conversations with our minority legislators, led by Senator Escamilla, to see really how we can address COVID, the COVID pandemic among our racial and ethnic minorities. And we saw the need of, we need to involve community health workers. So we were very close to get funding to start a pilot project that the COVID community partnership. So we did the pilot May through September, and then we got the additional funding to extend phase 2, September to December. And now we are working very hard to get funding and continue on phase 3. I'm very positive. We are gonna have a phase 3 for the COVID community partnerships. And this is an excellent project that is showing how important the role and the work of community health workers is in addressing, disparities, COVID disparities. So I hope that we can use this project as an evaluation tool to show everybody the key role of community health workers when addressing disparities among our minority communities. Thank you, everybody, for your work on this project.
Thank you, Dulce. We are lighting the candle every day to make sure that we will have funding for next year. So yes, we will continue lighting the candles. Our next speaker is Cynthia OConnor.
Hey, good morning, everyone. My name is Cynthia OConnor. You can call me Cindy. I'm here representing AUCH, the Association for Utah Community Health. I'm the Community Health Services Division Manager there. I've been with AUCH for about 3 years, but have been working in the CHW space for about 1.5 years, 2 years. I'm super excited to be here and to see you all and to meet you all. And AUCH currently has a couple of CHW teams through UDOH and Salt Lake County in response to COVID-19. So I'm really thankful for all of the work that our CHWs and all of the CHWs across the state are doing. And I think as difficult as a time it is right now dealing with the pandemic, I think it shined a lot of light on the CHW work and the services that CHWs provide and how important they are for our community. So happy to be here.
Thank you, Cindy. Next speaker, it's going to be, I am so thrilled because I have superstars today that I'm talking to. So I am just so thrilled. Dr. Rivet Lopez.
Hello.
Oh, we have you. Yes, I saw you.
I'm so sorry. I had to join through the phone. I apologize. Hi, everyone. I'm so happy to be here with such good company and so positive thinking and such positive journeys that we're going to end up having, because out of the bad comes good sometimes. And I think that our alliances say that a lot. So I bring in the community health worker / student combo. Both my favorite things to do is work with community health workers, communities in general, but also I'm a professor and I love thinking that we are shaping the future and bringing the students to a level that perhaps is even more helpful to our communities that are disadvantaged, of course. And So in that regard, I work with two hats at least. Beautiful hats, both though. So one is with the School of Medicine, and that is trying to insert the community health workers into their classes, into their coursework. So into the curriculum in general. So that has been interesting. But right now I feel like we have good footing, and so we'll tell more about that. I mean, they're part of the coursework, is what I'm telling you. They're not just invited speakers. The other one is as part of the COVID-19 CARES grant that we got at the AHEC, at the Utah Area Health Education Centers. And so for that, they are also, they prepared a curriculum for COVID-19 and different populations. And yes, they did. They wrote a curriculum. And then they're gonna prepare an innovative teleeducation way of teaching the AHEC scholars about how to be better prepared to address communities. So I feel like that's a winner for all involved, because we need professionals that when they get out there, they're up to snuff about, you know, communities and their real needs. So thank you.
Thank you so much, Doctor. It's really exciting to hear that. Our next speaker today, it's a friend of mine also, and you know, he's also a city council, Jake Fitisemanu. I know that he comes today in another hat, but yes, let's introduce Jake.
Hello everyone, talofa mo lave mo li atuele anganga fafitai mo ne avanoa talofa. My name is Jake Fitisemanu, and I'm here in my role with the Utah Department of Health, where I am the contract testing manager for our COVID-19 response statewide. I'm also very proud to lead our Utah Pacific Islander Health Coalition alongside many of the great people who are on the conference today. And yeah, like you, Yehemy, I'm starstruck. This is a great panel you've put together here, and I'm looking forward to learning from my colleagues and the other panelists as well. Thank you.
Thank you, Jake. I cannot take credit for it. This is an amazing work that Oreta has, and I have to say it. And our last but not least speaker today is Tessa Acker.
Hi, everyone. Thank you so much for the opportunity to be here. And like everyone's been saying, it's an immense honor to be amongst all of you superstars. Like Oreta, it's a pretty emotional thing to see, to feel us all together, and to see us all together, and to see where we are. And I've only been a part of this for the last couple of years. I truly can't imagine those of you from the beginning that have been working so hard on this. So thank you. I work at the Utah Department of Health as the community health worker liaison. I was in Kevin's position before. He did an incredible job. Shout out to Kevin, as the CHW specialist with EPIC. And when the pandemic hit, we created the COVID-19. So it's actually called CART, COVID Active Response Team. And so I was able to join that team as the community health worker liaison to continue to support the role of community health worker during the COVID-19 response, and continue to advocate for how incredibly important their role is in this response. So I have been really honored to work in this space, to partner with the Office of Health Disparities to support their COVID community partnership. And I view my job as always following the lead of the community health worker section. So I've always said that they are my guiding light. I work for them. I follow their lead and try and uphold that nothing about us without us. So that is my role. And again, just so grateful to be here and see you all. Thank you.
Thank you, Tessa. So we are going to start with the first question that I do want to ask, and it is, what's a clear understanding about the work of community health workers, their role, and why they will be effective in the state COVID response efforts? What do you think? who would like to start?
I can start saying that the project that we are running, the COVID Communities Partnership, is based on community health workers. We will not be able to achieve what we have been achieving without community health workers. They are the gatekeepers for underserved communities. They know their communities, and they have been amazing. That's all I can say. It's like we understand everybody is going through very stressful situations. Community health workers, you know, at the top. That's the reason we incorporate some emotional and mental support through the University of Utah, the Cares Connection program, because we really can feel all the struggles of the community, and the community health workers have to deal with that. So from the point of view of the Office of Health Disparities and the Utah Department of Health, I will say that we will not be able to work on the COVID disparities without you. So it's like you are the rock stars in this pandemic, in addressing disparities among our minority communities. So the project would be impossible without you.
This is Jennifer. I'll go next. And I would say that all of our state leaders and the county leaders did an excellent job of putting the CCP project together. So we did have a clear understanding of what the work would be. I don't know if we knew how emotional it would be. I mean, we all know that specific communities are being affected harder. COVID has shined a light on the disparities. And I think it's been challenging just seeing COVID on top of all of the other issues or problems that people are dealing with on a daily basis. But I think you guys all did an excellent job putting this project together. So we did have a good outline of what the work would be. And you all have been very supportive, and the amount of referrals that we're getting has just been incredible, but we do have that support. And anytime there's something that has come up, you guys have all been very responsive in adding resources or coming up with ideas to meet those additional needs or whatever that issue is. I think it's been a really good project so far.
I don't know what to point out, but I would love to hear from Cynthia, since she works with community health workers directly, if it's okay.
Of course, yes, no, totally. So I think that we did have a pretty clear understanding of what the expectations were for the project. I think it was an adjustment for us to change our intervention. So I think, you know, AUCH has a fairly structured community health worker program with a fairly structured intervention. And so we did need to make adjustments to how our CHWs were intervening with this population, given that it was specifically focused on COVID and needs and addressing needs that were arising from this population due to COVID. So it was a challenge for us to make those adjustments, and it was very much kind of learning as you go, but we learned a lot, and our CHWs were absolutely amazing at adapting and taking all of the lessons that they've learned from their CHW work in the past and making the necessary modifications to address these COVID specific needs. I will say too that I think this project really forced us to introduce some more formalities to our program, if that makes sense, with the requirements that these projects brought. I think, and maybe not just for AUCH, but I think for a lot of CBOs, it made us learn, wow, we have to do a lot of reporting. Wow, we should probably be asking these questions and collecting this data. And so even though AUCH has been doing that, kind of making those quick modifications and realizing that we need to be capturing these things that sometimes get lost in the process of our intervention and just in general program management, it was really helpful for us. And I think we're going to take a lot of those lessons and adapt that to the projects that we take on moving forward.
Good.
If I can just really quickly share. So our position was a little different because we weren't working directly with the populations. And so as a state position, I deeply relied on the stories and the qualitative information that was being brought by you and Arita and Janetta and Jake and Margarita when she was with us, and Susie. I mean, you were the front lines. And so unless we had your voice at that table, we would have been creating policies, practices, and engagement efforts that had absolutely no culturally responsive thought to it, or the framing itself would have missed the mark. And so again, I just want to note that the community health worker model has been so meaningful to developing the conversation at the state, where we recognize that moving forward, this has to be a part of ongoing initiatives. And again, Dulce and her leadership and her courage to be able to say, like, you had these promotoras all along. Now activate it and grow it. Implement a program that we know in our communities from the peer-to-peer model that this works. So with the COVID-19 partnership, with the Multicultural Advisory Committee, none of this would have been possible without the leadership of each of you who show up every day to make sure that you are advocating at multiple areas. Like, it's not just in our meetings, it's with separate commissions and committees that you keep showing up. So again, I just wanted to acknowledge that the work that we're doing is deeply rooted in policy. And unless you were at the table, we would be crafting policies that were failing to fit the needs of the community.
And just to build off of what Nubia and Dulce and Jen have said, just about the immense lessons that we have learned from your experiences on the ground, and especially during the COVID-19 response, because we were trying to act so quick and we were trying to respond in sort of this emergency situation, we often would propose certain programs or certain systems or certain ways of doing things. And so often we would hear back from you like, that's not how that works on the ground. I'm hearing exactly what Nubia said. These stories from the community are informing the way in which we're responding to COVID-19. So if people showing up to testing sites aren't showing up because they're worried that they're going to be asked for identification or citizenship or things like that, that's how we need to set up these systems in these services so that people feel comfortable. Within our refugee population, something that really hit me was one of our partners saying, some of these members back in their home country have dealt with malaria over and over. And so COVID-19, these messages may not be resonating with them. They may not really understand, what the big deal is. And so it's just understanding kind of those unique perspectives and those things that, we aren't always discussing and we aren't always hearing. And then having that open communication channel and having that opportunity to learn from the community and have that guide us has been so important. And I just want to give one last quick shout out to also the local health departments across the state who have been able to take on community health workers as well and reach parts of the state that we have honestly never possibly reached before or had as much focus on. So just the fact that local health departments and community health workers across the entire state have been able to come together on this response has also been just absolutely invaluable.
I would also like to add, from the perspective of the university, working with the university, and that is another system, building on what Tessa said. We are here to bump against the system at times. And so, it's not like people are going, oh, yes, I know. Sometimes you have to start by educating the people, that write the checks to, about the value, of this operation. As I put it, I always call them the solution. And so the community health workers have to be heroic in their patience with the systems. And I really want to acknowledge that, because they realize that change takes a lot of you know, organized, you know, pushing, you know, for things to change and be different and more to our liking. And so it's a little easier to push now, because we have the students in our favor, because the students are like, yes, we have to have more community health workers and all that stuff. So when the audience wants something, you know, when there's demand for the product, then people really can be more supportive. You know, with the demand from the students, this is only going to get bigger, because all the, you know, it's with School of Medicine. We also did a program with the PA program, and you know, so it's just going to get bigger and bigger, because people are going to see that they really are the solution, you know, to connecting people with health, increased health and better health outcomes, and everything clicks. So
thank you. So I want to pass to the next question. We already touched some of the questions that I have. I appreciate Tessa and all of you to, you know, for responding this. So what areas or improvement can we learn all, as you know, not just community health workers, but community-based organizations, from the partnerships that you have created with community health workers throughout, you know, throughout this year? I would like to ask these questions first to Jake, to make sure that we, you know, let space for everybody to speak. So what you can share with us, Jake, in terms of the learning opportunities, you know, in partnership with community health workers that you have experienced?
You know, from a professional, academic, scholarly approach of public health and clinical medicine, it's fairly easy to have a mindset that we know a lot, or we know more than you, or we know it all. And that simply is not the case. And when it comes to lessons learned, and with a community-based background, you know, personally, that approach, that very paternalistic or very one-sided top-down approach to public health intervention and to any other community based program or project never sits well. And so I think the lessons that have been learned from the institutional side have been phenomenal in seeing that even with very limited resources, even with a limited workforce, that the work and the outcomes and outputs that we're seeing from community health worker organizations, individual community health workers and advocates, is phenomenal. It cannot be understated. And I think it's a lesson that many of us, that institutions know, or at least say that they know, but to see it in action and to actually acknowledge the fact that community health workers and community advocate organizations are essential to this COVID-19 response, I think has been a big learning lesson for a lot of people in my particular sector. And so I think being able to acknowledge that community health workers and community advocate organizations, while they may be small, they may be you know, isolated, or they may be working in different niche communities, those really are the pieces that we need to engage in order to make these statewide or county-wide or population-wide changes. We need to reach all those little niches. We need to reach those different linguistic communities. We need to reach different communities of faith, etc., that may not be accessible through our mainstream public health promotion and media approaches. And so I think those lessons along the way have been good for institutions to learn. And yeah, it would have been nice to have learned some of those lessons sooner, rather than wait for a pandemic that really has exposed a lot of these disparities. But I'm grateful that people have been seeing the light, and that we are learning how to better engage with community health workers, how to trust community-based organizations with funding and with resources so that they can actually be the ones to provide those services in all corners of the communities that ultimately we're trying to serve.
Thank you so much, Jake. I think that validates most of the language that we have used throughout the year. Some of us that are doing the advocacy work, throughout the community health worker movement. So I really appreciate your input, and I would like to hear from Teresa. I never asked you actually, Teresa, if you want me to pronounce your name as Teresa or Teresa. So I will love to hear your input and also to let me know how would you like me to say your name.
Yehemy, you are so gracious. I much prefer when you pronounce my name. I can't say Teresa very well. I speak Dutch and English, and Spanish is just not something that rolls off my tongue. So to hear you pronounce my name in that way is a beautiful thing. So thank you for that. I love that. Jake, I'd just like to jump on to what you're saying, because the lesson from the past for organizations is that community health workers are an amazing, cost-effective, underpaid, and underutilized, I don't want to say intervention because that depersonalizes it. Community health workers, my experience over, somebody said they had been a nurse for 45 years of working in healthcare. My experience is that community health workers are the first people we turn to when we have a problem and we need a culture, we need to get to a community in the right way. And they are also the first group that organizations choose to defund. And they're the first group that organizations say, well, that we only put $10,000 towards that. So that's an easy budget cut for us. It happened, those of us who have been at this for a while have seen it happen time and time and time again. I hope Dulce, you're nodding your head with me, because we've seen the health department go through phases with community health workers. And this last phase has been the most energetic and the most persistent. And our risk is that this will not persist when the pandemic goes away. And I think the lesson has to be for organizations, and the partnership lesson is that the infrastructure that we put in place, the funding that we put towards stipends and paying community health workers, because this is a position that deserves to be paid, and the work that we put into place to get it reimbursed by insurance companies and Medicaid and other organizations will only help us raise all the boats and improve health for all the other things that we want to impact, heart disease and chronic disease and healthy babies and full-term pregnancies and all the other important health outcomes we want to see. We cannot let this infrastructure go away. That would be a huge mistake, because the return on investment is there. When I worked for Intermountain Healthcare, we proved it to Intermountain Healthcare. I'm really thrilled to see that AUCH still has community health workers. This is meaningful, important work, and it has to continue. And the partnership lesson is that we can't retreat to our silos when the pandemic goes away, because it will go away. God bless America, it will go away. But we have to be able to stand together with the data and the stories and the passion to convince people that this is an effort worth continuing. This isn't a convenient effort. And if we don't pay attention to it in the times when we're just worried about little things like heart disease and diabetes and birth outcomes, when we really need community health workers, when we have a pandemic, they won't be there. And we'll be revisiting this cycle all over again. I'm just a little bit passionate about this, can you tell?
We share the same one. No, don't worry. I do believe, I'm a firm believer as well as you. 100 years ago when the Spanish flu happened, we have similar circumstances, and it was 100 years ago. Right now we're in 2020, and we are facing almost the same challenges, almost the same barriers, and so hopefully, you know, right now that there is an addition of us working in this field, it can be different, and it can, you know, and it can change for the future. And hopefully, I'm knocking in wood that, you know, in the next pandemic, on the next impact that we will have in our country and in the world, we will be more cautious, and we will pay attention, as Jake was mentioning, to the people who work in the community, because I do believe that, you know, collaborating together as a partnership and as an equal partnership is what it's gonna make our communities stronger and better. So yes, I agree with you, and I agree with the passion, Teresa. So for my next question, if it's okay, I would like to ask, what do you see for future partnership with community health workers? And I do want to point out, Dulce, if it's okay, you know, because you have been working with us for the past year, and I think that it would be good to hear from you, specifically because I know that you have been working with all the community health workers throughout the state. So I open you the door.
I think that COVID and COVID funding is bringing us an excellent opportunity to improve and diversify the work that state and local agencies do with community-based organizations. I can tell you that at the State Health Department, the Office of Health Disparities is the one with the most contracts. So anytime that the Office of Fiscal Operation is like, they are scared of me, because to manage contract is extremely difficult. As I will follow up with Teresa just said, usually the big government agencies prefer to have just one big contract and give all the money to them, because it's easy to manage. So when you have 32 different contracts with different organizations, so smaller organizations, is difficult and is challenging, you know, for the bureaucracy of the state, because the state is not used to do that. But hopefully they are learning that, you know, if we want to make a difference, we need to bring everybody at the table. So I don't care if it's a small community-based organization, local health departments, we need to hear everybody in order to reach everybody. So I hope that with this project, we are making a difference. State Health Department is learning that, you know, we need to manage all these agencies. The Multicultural Affairs Office have done the same with all the contracts that they have for wraparound services. We also introducing community health workers and local health departments. So I think that we have a great momentum, and it's like, let's take advantage of maybe one of the few positive things that COVID brought out, and it's like, just, you know, work together, keep working together, and make this effort between academia, state government, local government, and community-based organizations. We are a team, and we really need to work together to show how important this work is. And that's the reason the CCP project has a strong evaluation component, because we want to give the data to the legislators so they can see how important your work is. So I'm very positive, and I'm hopeful that, you know, this is just the beginning. So community health workers have been here for a long time, but now, you know, they will be, you know, at the top to really, you know, working with government agencies, academia, private institutions to keep moving forward. So I'm really very positive. I think that probably this is one of the few positive things that COVID brought us.
Yes.
Yehemy, if I could jump in, I'll try to be brief, which is difficult for me. I'm thrilled to hear all of that, Dulce. I think that's very encouraging and hopeful news. I'm having an early thought bubble with myself about why is it, and I put this in the chat, about why is it that community health workers are the only member of the healthcare team that we depend on grant funding for. In general, as a philosophy, that to me, I am learning and on the journey with a lot of average white people like myself about systemic racism and inequities. And this to me seems to be, I'm just trying to figure out what's the root cause of why do we continually have to have this battle about the value and the worth of community health workers. That, I mean, we know it in our hearts. Yes, we haven't documented it, but there is much work to be done in that way. I wonder if we ourselves have to start talking and create some new language around the purpose and the inclusiveness of community health workers on the healthcare team, so that it becomes natural and regular and interdependent, and not something that we add on when we happen to get a grant to do this work. So I know I'm pushing against some various things, but I would hope that we can start thinking differently about this work and its value, so that we can, yeah, there's an inequity here somewhere, and we gotta bust through that and get it in a different spot.
If I can add something here, or were you gonna?
Go ahead, no, go ahead, Dr. Ivette.
When you say the root cause, to me is racism and classism, pure and simple. You know, I know more than you because fill in the blanks. And I am used to thinking less of you because.
Well, I also wonder if it's somewhat.
I'm sorry, if you could just let me finish.
I apologize.
No, because it just flies out of my head. It's not you, but if I don't finish. But anyway, so that is the part of our labor that knocks into systems. You know, why is it hard to pay people differently for work that you can't do in your office and I can't do in my, you know, for expertise that is valuable? If it was you, you would be demanding to be paid on time and blah, you know, but somehow, you know, for these. So we had a wonderful presenter for our AHEC Summit, Dr. Camara Jones, and she asks us to ask that question: could racism be operating here? You know, and it's a simple question, but I've brought that up in budget discussions, all the way to strategic planning meetings, etc. And, you know, people in general don't like to talk about these subjects. It's like, oh, I don't want to say anything wrong. But, you know, the thing is that it keeps coming up, and we have to have it keep being addressed, because don't forget that we had a pandemic of COVID, but we also had a pandemic of racism in this country that became equally visible to COVID, with the violence against minority groups, especially Blacks. But so I just had to say that there. Also, in general, my friend, people don't like history. Which is why I think possibly we keep repeating it. So just a thought.
Yeah, and that's why it was so important what Kevin was mentioning in the morning. If you see the history of us, if you see the history of our community health workers, promotoras, most of us are women of color. So you don't have just racism, but it's also sexism, because we're trying to prove, you know, we're trying to prove that we matter, or that we have a specific set of skills that are going to be equal as important as the regulations that the rest of the fields had with the requirements. And I think that it has to do with misogyny as well, and definitely racism, to prove the worth of us and to prove the worth of the work that we do, because we come from the community, and not necessarily we all have the titles. We not necessarily all have a document that established that we know what we know, right? There is not a document that established that you understand the Latino or the African American community in this moment of time. And also, we do believe the importance of the community and the essence of the community. So that also has an impact in it. And I would love to hear from the expertise or the experience of, that Nubia has had, working with community-based organizations, and what she sees in the future for partnership related to community health workers, if it's okay.
Absolutely, Yehemy. And just very quickly before I dive into that question, though, I do just want to acknowledge Dr. Lopez. It's absolutely something that we need to address transparently, authentically, and boldly, is that at the root of this is racism, sexism, and the intersections of oppression. And unless we are calling it what it is, we'll continue to beat around the bush. We'll continue to create policies and practices that disallow capable, brilliant people from doing the work and be compensated justly for it. So this is also a conversation about economic justice, right? So there's all of these various layers to this. And I think that's also part of the reason why, as we were unpacking and thinking about the Racial Equity and Inclusion Grant Program, that's what we called it, racial equity. And we said that we would prioritize organizations that worked at nonprofits who were severely underfunded, who were led by people of color, and who were historically serving communities of color. We have to call it what it is, and then we have to work to make sure that funding does address the root causes, which are these barriers. Something else I wanted to share is that we just presented, we did a partnership, the Multicultural Advisory Committee did a partnership with 11 partners to write a report on the disparities that are faced by communities of color during the pandemic. And they interviewed several of the community health workers, Dulce included, Yehemy, Janetta, Areta. There were several folks that were brought in because of your historical knowledge about what has been done in the state of Utah and what is also missing. And we then presented it to the Health and Human Services legislators, and we asked them for feedback and input. And Representative Jen Daly Provost was on the call, and she specifically mentioned that we need legislation that is adding and including community health workers into the model where Medicare, Medicaid, and all aspects of insurance are covering. Right? That's what we need to be doing, is working to address the systems and create the policies to eliminate the barriers to make sure that this is sustainable as a funding operation. So please just know that those conversations are happening, but again, they would have never happened had it not been for each of you sharing your voice, your thoughts. In addition, in the report, one of the things during the Multicultural Advisory Committee that came up is that our community health workers don't receive hazard pay. They don't have insurance. So in addition to the fact that you're showing up every day to the community, you're getting them resources, you're connecting them as case managers, as cheerleaders, as advocates, you are doing the role of so many different folks, right? And yet you don't have that additional compensation to make sure that you and your loved ones are covered. So that is one of the recommendations that we're placing in that report, and we're hoping to put that in the hands of the legislators. So again, we can really start to think about the systemic practices. So Yehemy, in terms of the future, that's how I see our partnership really advocating, elevating the story of community health workers and promotoras, is saying that yes, racism has to be addressed. Yes, we have to talk about this from a lens of economic justice. Yes, we have to make sure that nothing is created without your perspective and your voice, and that we make sure that the partnership is inclusive to address the gaps and the needs that we see in our communities. Thank you.
I definitely agree with you, Nubia. And I am speechless. That's what I can say. Speechless. we're almost at the end of our panel discussion today. So before we end up our conversation today, I would like to ask you, to every single member of this panel, to if you could share with stakeholders or people who would love to hire community health workers or work with community health workers, what message can you share with potential partners, you know, those people who might be thinking of working with us to hire community health workers, the value in you know, the value that we bring here in the state? What would be your message to share today? And I think that we can start with Cynthia, if it's okay with all of you.
Sure. My final message and takeaway is that CHWs are the key to our communities, and the systems that we have in place right now that CHWs work in, the systems need to learn from the CHWs, not the other way around. And I think that any organization or entity that's interested in bringing on board CHWs, I think really needs to be open. Apologies, there's a plane flying over my house. I think they need to be open to having that feedback from the CHWs, and they also need to be prepared to provide CHWs with support, legitimate support. And just to echo everything that the other panelists have said, CHWs have a really difficult job, and in a lot of ways they're way more difficult than the work that goes on the back end. And so I think the back end needs to be willing to support the CHWs and legitimize their work and advocate for them. And that's where that return, you're going to see that return on investment, because the CHWs really are the key to the communities and understanding community needs. And the other thing I would say too is while there's a lot of quantitative things that you can capture with CHW services, it's not just about the numbers, it's not just about the data. And I know, as we all have experienced with the different funding opportunities that have come along, we can't just rely on the numbers to see that return on investment. The qualitative piece is just as important, and the role that the CHWs play in empowering their communities, even if that necessarily can't be captured in a number, is just as important on any data that we're going to be asked for. So that's my final message. Thanks, everyone.
Yeah, my message to potential stakeholders and prospective partners would be that community health workers possess experience and expertise and knowledge, skills that cannot be cultivated and honed in a corporate or clinical or academic setting. If your mission and your vision and your organizational values espouse reaching the community, then you need to be honest with yourself and with your own stakeholders within the organization to genuinely invest in those who have those skill sets. It's not their first day on the job. They live and breathe community engagement and are residents within the communities they work with. And that would be my message to them, would be to, if you haven't already, try it out. Contract the community health workers, partner with a community health organization, and I think the results will speak for themselves, and the value of community health workers will be an incredible asset to your organization.
Thank you, Jake. Tessa.
Oh my, so many things running through my head. From my experience, having the great honor of community health workers allowing me into their space has been one of the greatest privileges of this work. I've worked really hard to build relationships and to also try and show up to their spaces as best that I can and as humbly as I can. I think oftentimes we want to invite people to our table, have their voices heard at our table, but it's been incredibly important and impactful for me to attend meetings with the section, to hear them in their own space and what is going on in their worlds, to meet with them for coffee or on the weekends or in ways, you know, that isn't just simply a quick meeting or a you know, a fast check-in or things like that. So I think, you know, build true relationships, build true friendships as you're able to, and just believe in the work. Don't hire a community health worker just to hire a community health worker. Do it right. Do it by them leading. Ask them what they need, what they want. Ask the community, you know, how do I work with a community health worker? How do I identify a community health worker? Allow them to build their own job descriptions. Allow them to tell you what the community needs. And then the last thing I'll say is, and I've heard, again, just passing on what I've learned from them, is do not expect them to solve all of your issues. I think kind of building on that conversation around racism and inequities in our system is like, suddenly now that there is this huge spotlight on community health workers, it is not fair, and it is not okay to just simply hire them and say, hey, we want a connection with the community, go and help us and help us do it. Community health workers need you know, immense support. They need their supervisor to believe in them and to trust them, and they need realistic expectations. You can't just allow them or expect them to solve this pandemic overnight. And so if for things such, this is just so timely, because as we talk about the vaccine, there's all these conversations around, oh, community health workers must, you know, I'm sure they can help us promote the vaccine, and potentially, yes, there is that partnership, but not, you know, without first starting with the community health worker and what they need and want and feel comfortable with. So I'll stop there. Thank you all so much. You all are so incredible. Such an honor.
Thank you, Tessa. Dulce.
So I will summarize that to stakeholders in just one phrase. We need to put the policies and practice in place so community health workers can be an integral part of any public health initiative and any healthcare team.
Well said. Thank you. Nubia.
Thank you, Yehemy. In terms of partners who are considering the value of community health workers, similar, I echo what everyone has shared and said. I would also invite these partners, however, to have humility in the conversations that are going to be had. And what I mean by that is invite accountability. There have been many times where I have trusted Yehemy to check me when we might be thinking about developing a program or doing some type of outreach, and Yehemy has come back and said, that doesn't fit our community's needs. And it humbled me, and yet it grew me. And so I grew professionally by the fact that she would trust me to hear them. And so I just wanted to acknowledge that there has to be a willingness to know that this model is getting developed. This model has been around for a long time, but as new people are coming into it, they want to change it. But the core, the soul of what community health workers are must remain intact. And that is your service, your willingness to do what is needed for the families who are hurting. And the last thing I would say to the partners is make sure that you are addressing the secondary trauma and the vicarious trauma and the pain that our community health workers are feeling every day. It is trapped in their bones. It is trapped in their heart. It keeps them up. It disrupts their sleep. And so this is spiritual work. This is mental health work. This is body work and soul work. And so for our partners, making sure that we value the human impact that our community health workers give to our community, but that also give to our organization. And so again, just to close my comments, I cannot thank you enough from our division and from the Multicultural Advisory Committee. I cannot thank you enough.
Thank you, Nubia, and thank you for allowing me to have these conversations. I know that not always are easier, but your willingness, it's been, you know, what keep us up, if I'm honest. Dr. Lopez.
Well, I would like to echo what everyone else has said. I am always feel a privilege to be able to work with my my collaborators, my colleagues, my solutions. I also, when you asked the question of how I would tell people, what I try to do is collect visual things and audio things. That's why they all have a video about themselves. I don't know if they were played earlier, I'm not sure, but if not, okay, so they were, I mean, I try to create these things so that they speak for themselves, and I don't, you know, what I say is, the other thing that I say is, look, this is the article I wrote, this is the data I collected, sit down, let's talk, because there's evidence that this works. It's not a pie in the sky thing. And at a time when we are so, you know, so drawn to what can we do quickly, you know, I think that one thing that you can do is involve these professionals and open the door and get out of the way, because you know what you're doing, and be there to support them.
Thank you.
Thank
Jennifer.
You.
So I would just echo what everybody said as well. Community health workers really are the boots on the ground. They have the connections with the community, and they have so many, you all have so many areas of focus. You know, I tend to think of medical just because of my training, and I see all of the great work that community health workers can do in the medical field. But the scope of the work you guys can do is just enormous. So I think letting organizations know, you know, all the different areas that community health workers can have an impact, and that really is where it needs to start. It needs to start with community health workers reaching the community to make that change. And one quick comment that I should have mentioned earlier, but I think, Dr. Lopez, what you're doing educating students, I think that's going to have a huge impact for the future. I think a lot of kind of the older generation isn't as familiar with community health workers. I think we do need to focus on educating, and again, not just healthcare, but I tend to focus on healthcare, but kind of reach the new students. I think, you know, as students grow and learn, you know, teach them about community health workers. So it just becomes natural. You know, other organizations already know what community health workers are, so it's not trying to introduce something new. It just becomes the norm.
I definitely agree with you, Jennifer. A work of mine every year, I will have students at Comunidades Unidas doing work with community health workers and promotoras, and dynamics change, definitely. Last but not least, Teresa.
To future partners and other folks, I would say, if you want to do one thing to change the health of the entire population that you serve, you would embrace community health workers. While you may have them work with a specific portion of the people that you serve in your clinic, in your organization, you will notice that everyone's health improves when community health workers become a permanent and natural part of your organization. And then the other thing I would say to them is, welcome to the good fight, because this is a good fight.
I definitely agree with you. I appreciate all of you. I have worked with you in one or another capacity, and, you know, directly or indirectly, Dr. Lopez. I think that you know, it's been a wonderful experience to have you here today and hear you, to hear, you know, how amazing allies you are with our movement, with our work. We would thank you so much for your time and your commitment to this movement. And also we thank all the people that listen to us today for, you know, for staying with us, for listening what we have to say. And also to thank Oreta, who has been such a key star here to put this together today. Thank you so much for your time, and I get back to you, Oreta.